Hello, in this lecture we are going to discuss how do we assess the risk of bias using the Cochrane risk of bias assessment tool. So we'll see what is a common classification scheme for bias. First we have described the selection bias. So what is selection bias? It is the systematic differences between the baseline characteristics of the groups that are compared. Okay, at the baseline only there are differences between the groups. So if we are selecting different kind of groups from the baseline only, then there is a selection bias. And how do we prevent it? Using sequence generation and allocation concealment. Then we have the performance bias. It is a systematic difference between the groups in the care that is provided or in the exposure to the factors other than the intervention of interest. Okay, and the relevant domain for this is blinding of the participants and personnel and other potential threats to validity. Then we have the detection bias, which is a systematic difference between the groups and how the outcomes are determined. Okay, so for this we have blinding of outcome assessment and other potential threats to validity. Then we have the accretion bias. In this, the systematic differences between the groups in the withdrawals from the study is there, and we have incomplete outcome data as the relevant domain in the Cochrane risk of bias tool for this. Then we have the reporting bias, which is a systematic difference between the reported and the unreported findings. This is because of the selective outcome reporting. So now we'll see how the Cochrane has classified the criteria for judging the risk of bias. We say there is high risk, low risk or unclear risk. We are going to see for each of the bias these risks one by one. Okay, so first is selection bias. So first we'll see in any of the research article, like there is an RCT and we are doing a systematic review with lot of RCTs. So each study we are going to check. So for the first study, suppose I am seeing, so I'll see the random sequence generation for the selection bias, whether it is present or not. If they have done the random sequence generation with any of these methods I have mentioned over here, then there is low risk. Okay, low risk of bias, low risk of selection bias in the study. Okay, so what all things we can do? Referring to a random number table. If the number has been selected using a random number table or the random sequence generation is done using a random number table, it is a low risk. Then computer random number generator is used, then also it is low risk. Other methods are coin tossing, shuffling the cards or envelopes, throwing dice, drawing of lots and minimization. Then it is high risk if the sequence is generated by odd or even date of birth, or by the day or date of admission, by hospital or clinic record number, allocation by the judgment of the clinician or the allocation by the preference of the participant, allocation based on the results of the lab test and the availability of the intervention. These all come under the high risk categories. Next we come to allocation concealment. Now we are going to check the allocation concealment, how they have done. If central allocation including the telephone, web-based, pharmacy controlled randomization is there, then there is low risk. Sequentially numbered drug containers of identical appearance is there. Okay, then the allocation concealment has low risk, and sequentially numbered opaque sealed envelopes are there, then also it is low risk. When it is high risk, when open random allocation schedule is there, a list of random numbers is given and openly they are distributing it. Okay, or use of non-sequentially numbered, non-opaque, non-properly sealed envelopes, then also it is high risk. And allocation based on the alteration or rotation, date of birth and case record number, it also comes under high risk. It is of unclear risk when the method of concealment is not described or not described in sufficient detail to allow a definite judgment. Like they say use of envelopes is mentioned, but whether they were sequentially numbered, opaque or sealed is not described, then it comes under unclear risk. Then we come to the performance bias. In performance bias, we see the blinding of participants and the personnel. So it is of low risk if no blinding or incomplete blinding is there, even if no blinding or incomplete blinding is there, but the review authors judged that the outcome was not likely to be influenced by the lack of blinding. And then blinding of participants and personnel is ensured and unlikely that the blinding could have been broken. That also comes under low risk. Then it is high risk when they say that no blinding or an incomplete blinding is done and the outcome was likely to be influenced by the lack of blinding, and the blinding of participants and the personnel is ensured but it could have been broken and this is going to influence the outcome. Then we say it is high risk. It is unclear risk when insufficient information is there for the judgment or the study did not address this outcome. Then we come to the detection bias in which we see blinding of the outcome assessment. Now, when it is low risk, when no blinding or incomplete blinding of the outcome assessment is there, but the review authors judged that the outcome measurement was not likely to be influenced by the lack of blinding. Or when it is there, blinding is done for the outcome assessment, but and it is not broken. The blinding is not likely to be broken, then it is low risk. High risk when no blinding or incomplete blinding of the outcome assessment and the outcome measurement was likely to be influenced by the lack of blinding, and the blinding of outcome assessment is ensured but likely that the blinding could have been broken, then it comes under high risk. Unclear risk, again, if it is insufficient information given or the study did not address this outcome. Then we come to the attrition bias, which has low risk, in which we are going to see the incomplete outcome data if it is given. We'll see the outcome data if it is incomplete. Then we'll see whether there is low risk, high risk or unclear risk. So low risk if there is no missing outcome data or the reasons for missing outcome data unlikely to be related to the true outcome, and missing outcome data balanced in the numbers across the intervention groups, okay, for similar reasons, then it is under low risk. For dichotomous outcome data, the proportion of the missing outcomes compared with the observed event risk is not enough to have had a clinically relevant impact, then it is of low risk. And for continuous outcome data, the plausible effect size among the missing outcomes is not enough to have had a clinically relevant impact, then it is again of low risk. If the missing data has been imputed using appropriate methods, then also it comes under low risk. High risk if the reasons for missing outcome data is likely to be related to the true outcome. For dichotomous outcome data, the proportion of the missing outcomes compared with the observed event risk is enough to have had a clinically relevant impact on the intervention effect estimate, then also it is of high risk. For continuous outcome data, the plausible effect size, that is difference in the means or the standardized difference in the means among the missing outcomes, is enough to have had a clinically relevant impact on the observed effect size, and it comes under high risk. As treated analysis done with substantial departure of the intervention received from the that assigned at randomization, this also comes under high risk. And if inappropriate application of simple imputation is there, then also it is high risk. Unclear risk if insufficient reporting is there. Then we have the reporting bias, in which we are going to check for the selective reporting. Low risk if the study protocol is available and all the study's pre-specified outcomes that are of interest in the review have been reported in a pre-specified way. And the study protocol, if not available but is clear that the published reports include all the expected outcomes including those that were pre-specified. But it is of high risk if not all the studies pre-specified primary outcomes have been reported. If one or more primary outcomes have been reported using the measurements, analysis methods or subsets of the data that were not pre-specified. If one or more reported primary outcomes were not pre-specified, then also it is under high risk. and one or more outcomes of interest in the review have been reported incompletely so that they cannot be entered in the meta-analysis, then also it is high risk. The study report failed to include results for a key outcome that would be expected to have been reported for such a study, then also it comes under high risk. Then unclear risk if insufficient information is available. Now we come to this risk of bias graph, which is given for any kind of systematic review in which we are doing the risk of bias assessment for the individual studies. Okay, so here green depicts the low risk, yellow depicts the unclear risk, and red depicts the high risk. Then this is the risk of bias summary figure for each of the study they have mentioned. What is the risk of bias in each study?